Hello, this is a headache tutorial presented by the SchrDbb with reference a practical guide to issue taking clinical examination by Anwar Qais Saadoon. Headache. Headache is a common complaint in pediatrics, especially in older children and adolescents. So it is primarily classified into primary headache and secondary headache. Primary headache are often recurrent and episodic. Example, you have migraine, you have tension type, you have cluster headache. There is no underlying cause. So primary headache, that is migraine, tension type, and cluster headache. There is no underlying cause. We have secondary headache, more as often have an underlying etiology. Example, intracranial or medical condition, like tumor or a trauma. So headache may also be classified in terms of time course. If you have acute headache, in case of intracranial hemorrhage infection like meningitis, sinusitis, pharyngitis, or otitis media can result in headache. We have acute recurrent headache. We have things like cluster headache, migraine headache, hypertension. If you have chronic progressive headache, think of things like abscess, like anything that has a space occupying lesion, like an abscess, a neoplasm, hydrocephalus, a pseudo tumor cerebri. The next is a chronic non-progressive headache. We think of tension type headache, chronic sinusitis, think of ocular disorder, medication overuse headache, and psychosomatic headache. It is very important to know the warning features in childhood headache, and then the warning feature is the mnemonic SNOOP. I'm going to tell you that later. So now we are going to see the type of headache. So now let's see the type of headache. The type of headache characteristic features. So we have migraine type headache. So this is an acute recurrent headache. Each attack lasts for about 1 to 72 hours. An acute recurrent headache. Each attack lasts for 1 to 72 hours, characterized by throbbing quality, moderate to severe in intensity. The headache is focal, unilateral, or bilateral, may switch from side to side, typically associated with anorexia, nausea, vomiting. Those are the prodromal symptoms. Those are the auras of the headache: vomiting, pallor, light sound sensitivity, visual symptoms. It is often triggered by chest tiredness or specific food. It often occurs in the afternoon, but sometimes awaken the child from sleep. It may be relieved by a short period of sleep. It is worsened by physical activity, so it disturbs the child activity. So note, there are different types of migraine. So we have migraine without aura, migraine with typical aura, we have vestibular migraine with vertigo, and you have chronic migraine. These are the 4 types of migraine. You have migraine without aura, migraine with aura, we have vestibular migraine with vertigo, migraine that has vertigo. Migraine without aura do not have any aura. Migraine with aura have particular symptom that before, when it comes, the patient knows that he's going to have migraine soon. And then we have chronic migraine. So those are the 4 main migraines types of migraine that we have. So aura is a neurologic alarm that the migraine will be taking place. It consists of visual, sensory, language symptoms that develop 5 to 5 minutes and last for 5 to 10 to 60 minutes after the headache. So now we have the second type of headache is tension type headache. So this tends to occur like a band around the head, and it can last 5 to 7 days. So it's like a chronic type headache. So a chronic non-progressive type of headache. It's typically bilateral with a tightening quality. So they occur late in the day and or may last all the day. They are mild to moderate in intensity and diffuse in location. They do not interfere with sleep. They may be associated with anxiety, depression. There is absence of associated symptoms like nausea, vomiting, photophobia, and all that. So the next one now is now secondary headache. For secondary headache, we have headache of increase intracranial pressure. What are the characteristics? What is the characteristic of headache with increased intracranial pressure? So this is chronic progressive headache of increasing severity. So it is chronic, it is progressive of increasing its severity and frequency. Frequently located in the same position. You have a headache on the same position. Increasing, progressively increasing, and chronic. It may be throbbing, pressure, or quality, or sharp in quality. It worsens by lying flat or coughing, and it is seldom relieved. So it is worsened when you lie flat or cough. So when you cough, you increase the intra-abdominal pressure that can increase the intracranial pressure. So it increases by coughing or when lying flat. When lying flat, you have more perfusion of blood to the brain, that increases intracranial pressure. When lying flat, even when bending forward, because it's more perfusion of blood to the brain. So you usually get worse in the early morning and may awaken the child from sleep. So worse in the early morning. When you have a headache that gets worse in the early morning, actually also with vomiting. So you can see that's a headache of raising intracranial pressure. So it disrupts the child activity, may result to vomiting, and may cause diplopia with a cranial nerve 6 palsy. So those are the things that are involved here. So headache with central nervous system infection, meningitis or infectious encephalitis. This is of acute onset, may preceded by upper respiratory tract infection associated with fever, neck or spine stiffness, followed by neurologic signs, seizures, confusion, lethargy, arthralgia, myalgia, PTK in cases where you have arthralgia, myalgia, PTK in case where it is a Neisseria meningitis. So you have also the symptoms of raised intracranial pressure. It's associated also with a headache of symptoms of raised intracranial pressure. Intracranial hemorrhage starts abruptly and develop rapidly, present with severe thunderclap hemorrhage, like in case of subarachnoid hemorrhage. It's often described as worst pain in my life. So it may be associated with loss of consciousness, local rigidity, focal. This is particularly for subarachnoid hemorrhage. The child may have a condition that may possibly lead to hemorrhagic stroke, such as coagulopathy, hemoglobinopathy, or heart disease. So now, what is a history taking in headache patient? You have identification, age and sex. You have chief complaint headache. You have history of presenting in a sudden, gradual, the duration of the headache. You have age of onset, is it chronic, the timing. You have daytime or nighttime headache. You have location. You have character of pain. We have the frequency of headache and duration of each episode. You have severity and progression, aura or problem. So what is the past history? Past history, you have past illness, depression, anxiety, motion sickness. So motion sickness, head injury in the past history. Medication history is taking any drug that can produce the headache. We have developmental issue, we have immunization issue, family issue, recurrent headache or issue of migraine in the family, parental description of their headache or other neurologic conditions. So what are the key points in headache? Key points in headache are acute recurrent throbbing headache suggests migraine. If you have acute recurrent throbbing headache that present as a band, is a tension type headache, a thunderclap headache, is subarachnoid hemorrhage. An acute onset of severe headache needs rapid assessment. It may require specific and urgent treatment. If you have an acute onset of severe headache, you have that. Chronic progressive headache, it shows enlarging intracranial lesion, space occupying lesion. Now, let's see the warning feature or the red flag of headache in a childhood. If you have a recent headache onset, an acute headache onset, that's the first thing, or sudden onset of headache, that's the first thing. Second thing, first or worst headache in your life. First or worst headache. You have occipital location of the headache. You have increasing severity or frequency. You have headache causing awakening from sleep, neurologic abnormality, visual changes, headache in the morning associated with vomiting, persistent. So if you have any headache associated that is of increased intracranial pressure, a headache with focal neurologic deficit, a headache which is the first and the worst in your life, sudden onset headache, a headache resulting to behavioral changes, those are type of headache which are red flags. So the next category things we are going to see today is seizure. Thanks for your kind attention.